Millions of people are living with neuropathy, but newer treatments can give those patients results they've never dreamed of. So today we welcome Dr. Cory Aplin, local neuropathy expert and author of Reversing Peripheral Neuropathy, a patient's guide for eliminating pain, numbness, and tingling to regain control of your life. Love the sound of that. Welcome back, Dr. Aplin.
Oh, thank you for having me.
So we were talking a little bit before the show, and you mentioned that you are board certified in neuropathy. So what does that mean exactly?
Yeah, that's right. You know, there's a lot of doctors out there that claim that they're experts in neuropathy, but they're still stuck in the old school mentality of just prescribing more and more medications. All these medications do is mask symptoms. They don't treat the actual condition. Those few of us that go on to become board certified, we're up to date with the most current research and, more importantly, the most technological advances to treat neuropathy without harsh medications or dangerous surgeries.
The last thing we need is another medication bottle on our countertop, right?
No, that's absolutely right. Yep.
I mean, we see a lot of that. So just remind us, what is neuropathy exactly?
Great question. It's a condition of the nerves of the hands and feet where the nerves actually start to die off over time. And as they die, they start to send these crazy signals like pain, numbness, tingling, burning. The muscles start to weaken. They lose their balance. The most common causes are diabetes, chemotherapy, and drug use. But, you know, there's over 100 different causes overall. 20 million Americans are afflicted with peripheral neuropathy, which equates to about 370,000 just right here in the DC region.
Wow, that's a lot. That's a lot of people. So, but what is it about neuropathy that made you so passionate to go in and become board certified and help the patients?
Well, I've been treating neuropathy for over 10 years now, and I really just got tired of seeing more and more medications being pushed on patients that mask symptoms but didn't do anything for the problem, and they come with a long list of side effects, right? Our country's already in a medication crisis. Most people come through our doors, they've been told there's nothing they can do for their neuropathy and that they're going to have to take medication for the rest of their life. The research shows us this just isn't true. Nerves can heal, nerves can regenerate, it just has to be under the right conditions.
And not as if you're not busy enough, you wrote this book, Reversing Peripheral Neuropathy. Yep. What made you want to do that?
Well, you know, I really wrote it as a patient education tool. What I learned early on is that many people with neuropathy, they didn't have a full understanding of their condition or realistically what their treatment options are.
Okay, so you've been doing this for over 10 years. So then with your approach, without the medication, without surgery, what makes it so successful to treating neuropathy?
Well, you know, neuropathy is a complex condition and it takes a comprehensive approach, but it all starts with making an accurate diagnosis because there's a lot of other conditions that seem like neuropathy but aren't neuropathy. Once we're able to accurately diagnose it, we can utilize FDA technologies like infrared and cold laser and electrobiofeedback. We can take diet and nutrition into consideration. Once we can get to the root cause of the problem, it allows the nerves to heal.
So stop being Dr. Google and actually talk to Dr. Aplin because a lot of times maybe somebody thinks they have neuropathy, but they don't necessarily.
Yeah, when I do a neuropathy event, usually 1 in 3 people that come in from one of the events don't truly have neuropathy. They have another condition that's similar. And we can treat those conditions, but we have to be able to make that accurate diagnosis first.
You want to make sure you're getting the right treatment at the right time. So who are the best candidates for these treatments?
Well, I always have to be honest with our patients. We can't help everyone, right? You know, for some people, their neuropathy is just too far along, but it all starts with a painless nerve evaluation. That way I can give an honest assessment for their condition. Realistically, the worst thing someone with neuropathy can do is nothing, right? The condition worsens every day, meaning the nerves die more and more every day, which makes it harder to treat every single day. My best advice to someone with neuropathy is don't wait for it to get worse. Just take action today.
Why live with it when you don't have to, and why let
right.
it get to a point that
Many people are
heal.
living with it unnecessarily. There are treatments for these things. You just have to be in the right place.
All right, Dr. Aplin, thank you for being here, informing us, and helping our patients. Dr. Aplin has a special offer for you, our Great Day Washington viewers. The next 25 callers qualify for a no-cost, no-obligation consultation to see if these life-changing treatments could be right for you. The number for River Medical Group is 240-283-4391. You can also visit rivermedicalgroup.com. This message was sponsored by River Medical Group.